All right, there are a number of causes when it comes to hair loss. I want to show our viewers a few of them. The first one is hereditary. That really is always the big one, hereditary hair loss.
So hereditary hair loss is where we're talking about usually like the male pattern baldness, the androgenetic alopecia, female pattern baldness. That's usually what we're talking about. And that has to do with a lot of different factors. Genetics plays a big role, and the hormones.
Immune system obviously overreacts. That's a big one.
So that's a very serious one that has to be diagnosed quickly. So that has to do with autoimmune conditions like lupus and things like that. So that's one of the reasons why you really got to get treated and examined quickly to see what the proper diagnosis is.
Some drugs and treatments as well, right?
Definitely. So a lot of drugs can send you into a telogen effluvium, which is basically when you start shedding more than you should be shedding. And for example, chemotherapy will send you into an anagen effluvium. So all of your hairs that are growing, that 85 to 90% of hair growth, that's when you lose it, and that's why it's so abrupt when you're undergoing chemotherapy.
We talked a little bit about the hairstyles that pull on the hair.
Exactly. So ballerinas tend to have some hair loss. The braiding and things like Ariana Grande. Oh, sometimes I see her hair and I think, you know, that's really tight.
Yeah, she pulls it really tight. You must sit there and cringe.
I do sometimes, yeah.
It's a little bit too much.
Exactly.
Harsh hair care products?
So harsh products can sometimes damage the bulb and the follicle, which is where we're producing our hair. So sometimes, you know, it's important for some patients to have those treatments done, but also you don't want to be doing them too often.
And this one is a little bit
so this is
compulsion to pull one's hair.
Right.
Why?
So this is a type of more of a mental disorder or a psychological disorder, and that's one that we usually refer over to a psychologist or a psychiatrist for that, because it's not really a hair disorder, it's that you're actually pulling it out yourself.